Are you transgender and see the situation differently? Let me know in the comments.
Oh, I'm transgender and I definitely see the situation differently, though not because I'm transgender. Correlation doesn't equal causation. I disagree because I'm actually familiar with the topic. You're pretending to be. And we'll get to that in a second, but first, I just need to give a quick content warning for the following. Transmisia, misgendering, misogyny, ableism, fascism, suicide, child abuse, outing, and medical violence. If you like our work, please consider supporting the channel via Patreon. You can also support us by liking, commenting, and sharing this video on social media. Hey there, my name is Hossenfelder, she, her, they, them, and today we're performing an autopsy on Sabine Hossenfelder's video, Is Being Trans a Social Fad Among Teenagers?, which claims to be an unbiased review of the data available. Said video was first brought to my attention by a viewer, like yourself, who expressed concern over the fact that Hossenfelder was promoting conspiratorial narratives regarding the existence of trans youth, and I thought, okay, I'll add it to the back burner. Then a couple more people asked me about it, followed by Rebecca Watson publishing her video, which is wonderful by the way, and I decided, fuck it. So yeah, that's how this video was brought to my attention and is why I'm sitting down with you to go over various key issues found throughout said piece. As already mentioned, Rebecca has produced her own response in which she supplied studies, some of which I've already commented on previously, others I haven't and subsequently stole. I'll also be adding a few studies of my own. That said, there are areas I feel Rebecca missed a thing or two, such as regarding the persistence and desistance stats and what they can tell us. There's also the more standpoint side of things in how I picked up on Hossenfelder's use of very specific language at certain points, little linguistic nuggets of anti-trans rhetoric that Rebecca may not be attuned to. Lastly, we have the historical context, which goes a long way in explaining why trans people are concerned about a video like this. And it's my job to bring all of that together. Lucky me. Now to help me do this, I've gone ahead and divided this response into two separate videos. The first video, this one, will tackle the pseudoscience of Hossenfelder's video, specifically regarding the benefits of gender-affirming care, the side effects of puberty blockers, and the myth of rapid onset gender dysphoria. The second video will pick up where we left off, explaining the fascist origins of rapid onset gender dysphoria, examples of Hossenfelder parroting fascist dog whistles, as well as Hossenfelder's reliance on both racism and intermisia to frame her arguments in a favourable manner. So be sure to subscribe and hit the bell icon to be made aware of when part 2 comes out. With that said, it's time to buckle in and get down to business, starting with what is an incredibly dehumanizing intro for a video pretending to be unbiased.
Should transgender teens transition? This rather personal question occupies a prominent place in the American culture war. On the one side, you have people claiming that it's a socially contagious fad among the brainwashed woke who want to mutilate your innocent children. On the other side, there are those saying that it's saving the lives of minorities who've been forced to stay in the closet for too long. And then there are normal people like you and I who think both sides are crazy, and could someone please summarize the facts in simple words, which is what I'm here for.
This right here is a classic example of the middle ground fallacy, also known as the argument to moderation or false compromise. The assertion that the truth lies somewhere in the middle between two allegedly extreme positions, with Hossenfelder falling back on classic ableism to drive her point home. Problem is, one of these positions is not like the other. There is actual evidence to show that gender-affirming care significantly improves the lives of trans people. As lined up by Rebecca in her video, one study, the Association of Gender-Affirming Hormone Therapy with Depression, Thoughts of Suicide and Attempted Suicide Among Transgender and Non-Binary Youth, published in the Journal of Adolescent Health in April of 2022, found that the, quote, use of gender-affirming hormone therapy was associated with lower odds of recent depression and seriously considering suicide compared to those who wanted gender-affirming hormone therapy but did not receive it. For youth under 18, gender-affirming hormone therapy was associated with lower odds of recent depression and of past year suicide attempt. End quote. Another study, Mental Health Outcomes in Transgender and Non-Binary Youths Receiving Gender-Affirming Care, which was published in the Journal of the American Medical Association Open Network in February of 2022, found that, quote, in 104 trans and non-binary youths aged 13 to 20 years, receipt of gender-affirming care, including puberty blockers and gender-affirming hormones, was associated with 60% lower odds of moderate or severe depression and 73% lower odds of suicidality over a 12-month follow-up, end quote. We also have pubertal suppression for transgender youth and risk of suicidal ideation, which was published in Pediatrics in February of 2020 and found, quote, a significant inverse association, as one increases the other decreases, between treatment with pubertal suppression during adolescence and lifetime suicidal ideation among transgender adults who ever wanted this treatment. These results align with past literature suggesting that pubertal suppression for transgender adolescents who want this treatment is associated with favorable mental health outcomes, end quote. The last study that Rebecca brought up was Psychological Profile of the First Sample of Transgender Youth Presenting for Medical Intervention in a U.S. Pediatric Gender Center, published in 2017 in the American Psychological Association's Psychology of Sexual Orientation and Gender Diversity, which found that, quote, older trans and non-binary youth seeking medical intervention experience poorer self-competence, higher levels of anxiety, and decreased happiness and satisfaction than the younger patients. The results provide further evidence that the resiliency of a significant number of transgender youth, as well as the severity of mental health concerns for others. New to the existing literature are the results showing older transgender teenagers as more distressed, supporting the clinical recommendation to consider earlier medical intervention for appropriate youth and to always incorporate mental health support and assessment, end quote. Again, thanks to Rebecca for lining these up so neatly. Adding to our studies, we also have psychological functioning in transgender adolescents before and after gender affirmative care compared with cisgender general population peers, published in April of 2020 in the Journal of Adolescent Health, which found that, quote, transgender adolescents receiving puberty suppression, 178, had fewer emotional and behavioral problems than the group that had just been referred to transgender care, 272, and had similar or fewer problems than their same age cisgender peers, 651, on the youth self-report domains, end quote. Next, we have psychological support, puberty suppression, and psychological functioning in adolescents with gender dysphoria, published in November of 2015 in the Journal of Sexual Medicine, which found that, quote, at baseline, gender dysphoric adolescents showed poor functioning. Gender dysphoric adolescents' global functioning improved significantly after 6 months of psychological support. Moreover, gender dysphoric adolescents receiving also puberty suppression had significantly better psychological functioning after 12 months of gonadotropin-releasing hormone analogues, puberty blockers, compared with when they had received only psychological support, end quote. I like this one as not only does it have a control, but it has a comparison group who had not yet begun puberty blockers and were only receiving psychological support, providing us evidence that puberty blockers offer a specific benefit, not just receiving care, as Hossenfelder asserts later in her video. I think the last study I'll give you is one that tackles surgery in young adults who had previously been on blockers, titled Young Adult Psychological Outcome After Puberty Suppression and Gender Reassignment, published in October of 2014 in Pediatrics, which found that, quote, after gender reassignment in young adulthood, the gender dysphoria was alleviated and psychological functioning had steadily improved. Well-being was similar to or better than same-age young adults from the general population. Improvements in psychological functioning were positively correlated with post-surgical subjective well-being. This led the authors to write in its conclusion that, quote, a clinical protocol of a multidisciplinary team with mental health professionals, physicians, and surgeons, including puberty suppression followed by cross-sex hormones and gender reassignment surgery, provides gender dysphoric youth who seek gender reassignment from early puberty on the opportunity to develop into well-functioning young adults, end quote. These are just a few of these studies Hossenfelder is going to have to tackle if she wants to pretend like there is no merit for the claim that gender-affirming care saves lives and that those who accept the science are crazy. So considering her degree of certainty, how many of the aforementioned studies does she attempt to tackle? Well, just the one. Mental health outcomes in transgender and non-binary youth receiving gender-affirming care, which looks at both puberty blockers and HRT.
Another paper that is often presented by people favoring hormone treatment is one that was published in 2022 in the journal Pediatrics. They followed about 100 young Americans that were either transgender or non-binary, or at least they tried. By the end of the trial, only 64 were left. So we're talking about a really small sample. About 2/3 of the participants began a therapy either with puberty blockers or gender-affirming hormones during the trial. The remainder served as a control group. The researchers observed 60% lower odds of depression and 73% lower odds of suicidal thoughts among youths who had initiated puberty blockers or hormone therapy compared with those who had not. They saw no effect for anxiety. In case that sounds good, here's the fine print. The mental health of those who were treated did not improve. What happened instead is that the mental health of those who were not treated got worse. And in the end, the untreated control group totaled 7 people. I know as a particle physicist I may be used to unreasonably high standards of statistical significance and sample size, but I'm not impressed. Aren't there any better studies? No, there are not. There are at present no high-quality studies that conclusively demonstrate these treatments are beneficial.
Starting with the first objection, that puberty blockers didn't improve mental health but merely prevented it from degrading further, that's literally the job of puberty blockers. We don't put trans youth on them with the assumption that it will fix gender dysphoria, but that it will prevent things from deteriorating, giving them up to 4 additional years to work alongside medical practitioners to figure out whether HRT is right for them. It's a safety line used to prevent them from reaching the point where they feel so hopeless that they consider taking their own life. That is how puberty blockers save lives. So Hossenfelder is arguing against a complete straw man of her own invention, moving the goalpost to suit her narrative. As for the second objection, sure, 7 is a small number. But as pointed out by Rebecca, Hossenfelder has cherry-picked her data, only acknowledging the 12-month follow-up whilst ignoring that the study also showed that, quote, depressive symptoms and suicidality were 2-fold to 3-fold higher than baseline levels at 3 and 6 months follow-up, end quote, with the control groups for said follow-ups being 38 and 24 people respectively, which is more than enough for a final sample of 104. The number merely shrank as the study continued, as more people were given access to said care, which is the only ethical thing to do. Because let's stop to consider what is being demanded here. Hossenfelder is demanding that a group of trans teens be subjected to the psychological torture of being forced to undergo physical transition via puberty, something that is incredibly traumatic and also results in a number of permanent changes. These numbers aren't readings of some natural phenomena taken from an instrument, they're human beings who deserve the best care available in line with the evidence, meaning we have to make do with what we have. That's the case for all medicine, including precocious puberty, also known as early onset puberty, that said blockers were originally developed for, primarily to combat psychological distress and the subsequent trauma of going through puberty too young. So all of Hossenfelder's critiques of said study are without merit, meaning she's done absolutely nothing to discredit it. That said, Hossenfelder also comments on a study I'm unfamiliar with, Psychological Functioning in Transgender Youth After 2 Years on Hormones, which was published in January of 2023 in the New England Journal of Medicine. Hossenfelder implies, among other things, that said researchers might have cooked the books.
Another issue pointed out by Jesse Singer is that the variables analyzed in the paper are not those they'd said they'd analyze in the pre-registered protocol. This means they had an opportunity to cherry-pick their results, which makes their measure of statistical significance obsolete. I'm not saying that that's what they did, but since they didn't adhere to the protocol, which they themselves pre-registered, it's a possibility that their results are just random noise.
Now again, I'm unfamiliar with the study. It didn't seem to make the circuit in the circles I'm a part of as someone who regularly writes on this topic. But that's largely irrelevant. Let's say, hypothetically, that what Hossenfelder is implying here is true and that the books were indeed cooked. One study being fraudulent does not matter when the overall consensus supports gender-affirming care. This line of argument is akin to when young Earth creationists point to fossil frauds like the Piltdown Man and assert that said fraud invalidates the entire field of evolutionary biology. Gender-affirming care is not based on any single study, but rather a collection of studies conducted where possible. As for the other studies, all Hossenfelder does is vaguely dismiss them without demonstrating good reason.
Unfortunately, the evidence that puberty blockers actually improve the mental health of children presenting with gender dysphoria is slim. Some studies have found a small benefit in the reduction of suicidal tendencies, but these studies didn't have control groups, so the benefit might have come simply from receiving a treatment and being cared for. Other studies have found that puberty blockers given to kids with severe and persistent gender dysphoria had no significant effect on thoughts of self-harm or body image.
First of all, puberty blockers are intended to stop things from getting worse. Any marked improvement is just a bonus. Second, we have multiple studies that compare trans youth receiving therapy, yet not puberty blockers, to those receiving both, showing that the group receiving puberty blockers has better mental health. Ergo, we can conclude that said benefits are the result of puberty blockers and not, as Hossenfelder suggests, simply from receiving treatment and being cared for. Thankfully, science is not beholden to Hossenfelder's whims, but rather the evidence. That is why both the American Association of Pediatrics and the American Psychological Association, consisting of over 67,000 and 146,000 members respectively, have issued statements in support of gender-affirming care, including puberty blockers. The American Psychological Association has even published referenced resources to help psychologists and pediatricians advocate on behalf of trans patients to fight attempts by the far right to block gender-affirming care across the US. We also have the Society for Research in Child Development, a group of 5,500 researchers, practitioners, and human development professionals from over 50 countries, which published a statement of the evidence declaring that, quote, "On average, after puberty blockers and gender-affirming hormones, levels of depression are no longer elevated, anxiety is reduced, body image improves, and suicidality drops to levels typical for all youth." The positive effects of gender-affirming healthcare have been found in adolescents during the initial medical transition and have been found to last years into adulthood. For example, transgender and gender-diverse youth receiving puberty blockers showed similar mental health to their cisgender peers and better mental health than transgender and gender-diverse youth not receiving treatment. End quote. They then go on to conclude that policies and practices that support transgender and gender-diverse youth in medical settings, quote, "do not ban or penalize the use of developmentally appropriate gender-affirming healthcare, including puberty suppression, gender-affirming hormones, surgical intervention, and mental health care for transgender and gender-diverse youth," end quote, and that there should, in fact, be a push to, quote, "require insurance coverage of developmentally appropriate gender-affirming healthcare, including puberty suppression, gender-affirming hormones, surgical intervention, and mental health care for transgender and gender-diverse youth," end quote. So if accepting the demonstrable fact that gender-affirming care saves lives makes one crazy, well, at least we have good company. There is an overwhelming scientific consensus that has mobilized in recent years to protect trans youth. So when Rebecca says,
Hossenfelder's opening statement is akin to saying, on the one side, we have people who think vaccines are a way for Bill Gates to inject us with microtransmitters, and on the other side are people who think vaccines are safe and effective ways to reduce the spread of disease. And then there are normal people like you and I who think both sides are crazy and could simply use someone to summarize the facts, which is, what I'm here for. Ooh.
She's not wrong in making that comparison. Not only is Hossenfelder ignoring the majority of evidence available in targeting one or two loose studies, but also the consensus reached by the overwhelming majority of specialists in the relevant fields. That is an incredible display of ego. Another thing to note is that whilst Hossenfelder gives a description of gender-affirming care that includes both social and medical transition, she only really focuses on the medical side, and even then, she heavily leans into puberty blockers, which she likes to present as being riddled with irreversible side effects.
Puberty blockers work in the sense that they block puberty. Side effects include, but are not limited to, weight gain, headaches, reduced growth, and a significant decrease in bone density. The effects of those drugs are often described as being reversible in the sense that normal development resumes once children stop taking them, but this is a dangerous oversimplification. There are few long-term studies on people who have been taking puberty blockers, but those that exist show that bone density is unlikely to entirely recover, which means a lifelong increase of the risk to break bones.
No citation is provided on this claim. Hossenfelder just asserts that there are studies that show bone density is unlikely to recover. This is just wrong. As shown in Use of Gonadotropin-Releasing Hormone Analogues in Children, update by an international consortium, a systematic review which was published in July of 2019 in Hormone Research in Pediatrics, which found that, quote, puberty suppressants slows mineral accrual. After discontinuation, bone mineral density appears not to be significantly different from that of their peers by late adolescence. Reports of bone mineral density among children and adolescents verified a decrease in bone mineral density at the achievement of near adult height, while accrual resumed after therapy, regardless of whether or not calcium supplements was given. By late-stage adolescence, all subjects had bone mineral density within the normal range. End quote. Said study looked at children suffering the early onset puberty mentioned earlier, who again were who the medications were originally created for. But there's no good reason to assume that the results would be any different for trans people, and if Hossenfelder felt any differently, she'd supply actual evidence to back up said claims, rather than continue to rely on vague assertions. Yet she continues, adding that
other studies have suggested that taking puberty blockers increases the risk of heart problems and may result in genital underdevelopment or fertility complications. Though I have to warn you that at the moment, none of those studies are particularly conclusive because the sample sizes are small.
Again, no sources given, but I'm actually not going to argue with this. Why? Well, because similar risks are actually pretty common among other hormonal therapies. To give you an example, one common form of hormone therapy can have the following side effects: sore breast, nausea, or headaches. Yet, more importantly, it carries with it an increased risk in the following: heart attack, stroke, blood clots, liver tumours, and in some very rare cases, even death. What's the hormone therapy in question? Hormonal birth control, also known as the pill. Something that is as close to being a mundane medication as possible and is even prescribed off-label to children for things like acne. An increase in risk doesn't make it likely and doesn't act as justification to treat blockers with higher suspicion than other forms of medications that have similar risks and/or side effects. Yes, your doctor needs to keep them in mind when prescribing said medications, but that's their job, not the job of legislators. It's worth noting that nobody took issue when puberty blockers were first prescribed to cis children in the 80s, They only took issue when they realized that they could attack them as a means to deny trans children essential support, making said children suffer. And it's not because they're prescribed off-label either, as seen in how birth control is also prescribed off-label for acne. It's just as a means of hurting trans people. Yet Hossenfelder continues.
On top of this comes the psychological problem that not entering puberty when all your peers do isn't easy to cope with either. In 2016, the American Food and Drug Administration ordered makers of puberty blockers to add a warning about mental health problems to the drug's label after they received several reports of suicidal thoughts in children who were taking them.
So let's get this right. You can discount the wealth of peer-reviewed studies which show the benefits of puberty blockers, yet unconfirmed reports are worth mentioning? Do you not see the double standard in what you are saying? Also, if the problem is trans teens not being allowed to go through puberty with the rest of their peers, the solution is to put them on HRT so that they can transition as their peers go through puberty. Not to remove puberty blockers. Puberty blockers were a concession to people who argued that allowing children to transition at an early age would result in high rates of transition regret. This is in spite of the fact that, as you acknowledge in your video, almost all trans youth put on puberty blockers go on to further transition.
At least in previous cohorts, most children who took puberty blockers continued with hormone therapy. According to estimates from the Netherlands, as much as 95%.
This is likely a reference to puberty suppression in adolescents with gender identity disorder, a prospective follow-up study, which was published in August of 2011 in the Journal of Sexual Medicine. Said study, consisting of over 70 patients who had been put on puberty blockers after assessment in the Netherlands, found that, quote, no adolescent withdrew from puberty suppression, and all started cross-sex hormone treatment, the first step of actual gender reassignment. End quote. Let's just stop to appreciate that for a second. 100% of trans youth put on puberty blockers go on to further transition. That in itself is further evidence for the success of puberty blockers in that HRT will be more effective than if the child had gone through puberty. It means they'll need less surgical intervention, which means lower risk and smaller recovery times. Hey, quick note here. Whilst editing this video, I realised that yes, this is the study Hossenfelder is referencing, with her even showing it on screen at one point. This confused me slightly since the study also found that, quote, behavioural and emotional problems and depressive symptoms decreased, while general functioning improved significantly during puberty suppression, end quote, leading to the conclusion that, quote, puberty suppression may be considered a valuable contribution in the clinical management of gender dysphoria in adolescents, end quote. Again, this is Hossenfelder's own source, completely contradicting her later conclusions. It's interesting to see how she cherry-picks which parts of studies to present as valid, and which parts to ignore. But returning to my point, if we have a near 100% success rate when it comes to puberty blockers, why not just put said children on HRT? If trans youth not going through puberty at the same time as their peers is a big problem as Hossenfelder suggests, why not let them go through the puberty of their choice? Either form of puberty, whether innate or induced, will have irreversible consequences, and innate puberty is not better because it is natural. Any assertion otherwise is what is known as a naturalistic fallacy. And if you argue we can't because of the slim chance that someone might transition and then later regret it, the same argument can actually be applied to natural puberty and the existence of trans people. That is an argument for putting every child on puberty blockers, or at least it would be if you were being consistent, which you never are. Again, puberty blockers were a concession to the people fear-mongering about transition regret. This was done to moderate your emotions. So all Hossenfelder has done here is demonstrate that, by giving them an inch, they're now demanding the whole damn mile. And to help them do this, they've invented a pseudoscientific phenomenon, rapid onset gender dysphoria.
In 2018, the American physician Lisa Littman argued in a paper based on survey results among parents that the girls being referred to gender clinics in recent years are different from those of earlier generations. They show an onset of gender dysphoria during adolescence, but without prior symptoms, a combination that was previously basically unheard of. Littman dubbed it rapid onset of gender dysphoria and suggested that it's a case of social contagion. Adolescent girls get the idea from social media or their peers or both and come to believe they want to be men, hoping it'll improve their lives. Superficially, the hypothesis makes sense. According to data from the World Health Organization, adolescent girls are twice as likely as boys to suffer from mental health problems such as depression and anxiety, so they're more likely to have a problem to solve in the first place. Littman speculates that girls that age are more vulnerable to social contagion than boys, though there's little evidence to back this up. Littman's paper was strongly criticized for not being a scientific study, but a collection of experience reports from parents. The parents were recruited among frequent visitors to websites who are skeptical that transgender self-identification among teenagers is genuine. This means the sample is unlikely to be representative. Indeed, Littman herself writes in a paper that it's a descriptive exploratory study. She describes what those parents say. What to conclude from that is a different story.
This is a grossly dishonest framing of what occurred. First of all, the sites were not critical of transgender self-identification, but rather that trans people exist or should be allowed to exist. They are part of what is known as the gender critical movement, a group of people who hold the shared belief that most, if not all trans people, are lying about their gender for a variety of reasons. For people assigned male at birth, it's apparently the desire to access women's spaces and rape them. For people assigned female at birth, it's apparently the desire to escape misogyny or is just part of an attention-seeking behaviour. That last one in particular echoes the bimisic belief that bisexual girls are just attention seekers, with both claims seeking to invalidate the validity of said people and thus their autonomy as human beings, treating AFAB folk as property. To say these people only take issue with self-ID is a lie, one that seeks to benefit anti-trans bigots by presenting them as more reasonable than they actually are. Second, nobody was criticising Littman's paper for using survey data, but rather the fact that Littman herself framed her research, which never surveyed the trans youth in question and could not even verify that its respondents actually had children that were trans, as evidence that rapid onset gender dysphoria was a real, scientifically grounded phenomenon. Plus one, the publishing journal received such backlash from the scientific community that it was forced to issue an apology and retract the article. Said article was then rewritten to make it explicitly clear that the study presented no such evidence. The sections edited included the title, abstract, introduction, discussion, and conclusion, all of which had maliciously misportrayed the data. Sadly, the damage was already done. In the 2 weeks it took Plus One to act, the news cycle had run with the story and spread the myth of rapid onset gender dysphoria to the masses. The case shares eerie similarities to that of Andrew Wakefield, the disgraced scientist who forged a link between autism and thimerosal, a safe mercury-based preservative found in older vaccines, leading Wakefield to become the figurehead of the modern anti-vax movement. The fact that Wakefield's paper was later retracted did not matter, any more than it did with Littman's rewrite. Littman weaponized science in an attempt to drive her anti-trans ideology forward as a figurehead of the gender-critical ideology. And said actions are not without consequences. Just as with Wakefield, Littman's paper has already harmed many trans people and has likely claimed lives as a result. There is blood on Littman's hands. But all of this is just brushed off as the vague, strongly criticised, with not even a mention of the fact that Littman was forced to rewrite her initial paper, because it was so dishonest. That's not an accident. That's a choice Hossenfelder has made, a choice she continues to make as she goes on to discuss further research on the topic.
A paper that came out in August last year claimed to have found evidence for the absence of this rapid onset symptom. However, this paper was also strongly criticized for severe shortcomings, such as, most importantly, for phrasing their survey questions in an ambiguous way and creative methods of interpreting their data.
Notice how Hossenfelder uses the identical wording of strongly criticized that she did regarding Lippmann's study. That might lead you to believe that said criticism was found to be valid and resulted in a similar apology being issued by the publishing journal, followed by a rewrite of the article. Was that the case? Of course not. This is just an example of both-sidism or false equivalence. Hossenfelder elevates unfounded critique to be on par with that of tested and justified critique, acting as if both parties are as bad as the other, when they're demonstrably not. Lippmann actually lied in her paper and was forced to correct it. The others weren't. Yet it gets worse, with Hossenfelder going out of her way to put her finger on the scale.
The brief summary of this controversy is that at the moment, there is no conclusive evidence neither for nor against the existence of rapid onset gender dysphoria, though it seems to be supported by anecdotal reports from doctors working in clinics who treat the children.
I'm sorry, what? You can't just claim that a fraudulent hypothesis is supported by anecdotal reports from doctors working in clinics who treat the children. Again, returning to the anti-vaccine comparison, this is something they do all the time. Anti-vax parents love to assert that even though there's no science to prove it, I just know my child changed after they got a vaccine and that it was caused by thimerosal. Ignoring the fact that thimerosal hasn't been an ingredient in children's vaccines for decades. There's entire forums of them saying this shit. This isn't just dishonest, this is negligent. Hossenfelder is very openly pushing an agenda while simultaneously claiming to be balanced. She claims to care about the data, yet routinely shirks real studies in favor of anecdote and rumor, as seen both here and earlier regarding the possible psychological effects of puberty blockers. The plural of anecdote is not data. It's a statement to remind us that anecdotal evidence is very open to bias sampling, with the researcher seeking out certain narratives or even the people behind those narratives seeking them out for some personal gain, which often leads them to lie. Take for example Jamie Reed, a gender clinic whistleblower who had previously worked at the Washington University Transgender Center. Reed published an article in February of this year which was titled, "I thought I was saving trans kids, now I'm blowing the whistle," in which she claimed that, quote, "There are more than 100 pediatric gender clinics across the US. I worked at one. What's happening to children is morally and medically appalling," end quote. In her opening paragraph, she goes on to explain that, quote, "I have spent my professional life providing counseling to vulnerable populations, children in foster care, sexual minorities, the poor," end quote, which in this context implies that she played an active role in the children cared for at said gender clinic. This seeks to lend credence to her claims that there are no, quote, "formal protocols for treatment," end quote, and that children who, in Reed's eyes, look to be a, quote, "manifestation or social contagion," end quote, that's code for showing symptoms of rapid onset gender dysphoria, were being handed prescriptions without scrutiny. Indeed, just like Hossenfelder, she asserts that, quote, "across the Western world, there began to be a dramatic increase in a new population. Teenage girls, many with no previous history of gender distress, suddenly declared they were transgender and demanded immediate treatment with testosterone," end quote. Wow, so we have a counselor at a gender clinic speaking out about medical malpractice? That's pretty big. And the gender critical crowd certainly treated her as such, plastering her story everywhere, which, considering this is the only real case like this, is likely where Hossenfelder sourced her own vague claim. I can't say that for certain, but I do find it incredibly likely. There's just one problem. Reed was not in any medical or managerial role and wasn't present in the appointments where doctors saw patients. Her role was making appointments, doing patient intake, and informing families about additional resources. You know, a receptionist. Things only continue to get worse from there as more than 24 parents, that's over 24 people, stepped forward to talk to the press, completely contradicting Reed's claims. For example, one boy, now 17, saw his therapist 89 times before he began testosterone. 89 times! So not only was Reed exposed as a charlatan in presenting herself as someone with a more active role in said children's care, but 24 parents decided to take time out of their day to get in contact with the press to explain that yes, there was protocol in place, Reed had just lied. It's almost like there's a reason that even qualitative studies follow certain rules when it comes to sampling. Of course, rapid onset gender dysphoria is only half the picture, with the other half being the assertion that young girls who believe they are trans are being given access to medications without proper scrutiny. That's why Hossenfelder brought up the facts that almost all trans youth put on puberty blockers go on to further transition.
At least in previous cohorts, most children who took puberty blockers continued with hormone therapy. According to estimates from the Netherlands, as much as 95%.
That's why she concludes her video.
Just exactly what is going on, no one really knows, but the reasonable expectation is that the current increase in reports of gender dysphoria is caused by a mixture of two causes. Young people are more comfortable being openly trans, and some of them erroneously believe they are trans because they've heard so much about it. I'd say that anyone who insists that one of those possibilities doesn't exist is pushing an agenda and shouldn't be taken seriously. The question is, how do you tell these two possibilities apart? This is currently unclear, and this is why countries like Sweden, Finland and the UK are asking doctors to hold back with prescriptions, because at the moment they don't know how to deal with the sudden surge of girls presenting with gender dysphoria, and they don't want to do any harm.
Except we can tell the difference. You remember the Dutch sample Hossenfelder mentioned when she talked about the persistence rates for trans youth put on puberty blockers? Well, the team behind the research has published multiple studies on different aspects of said data, including desisting and persisting gender dysphoria after childhood, a qualitative follow-up study, which was published in October of 2010 in Clinical Child Psychology and Psychiatry. Said study found that, quote, a marked difference between the reports of persisters and desisters was that the persisters reported that the discomfort was caused by the fact that their bodies did not conform to their feelings, whereas the desisters did not report this, end quote. They also went on to add in their discussion that, quote, although both persisters and desisters were quite similar in their gender atypical interests, preferences and behaviours, there was also a difference. This seemed to be subtle and belonged to the area of underlying motives rather than overt behaviour. The persisters attributed their gender dysphoria primarily to the discrepancy between their body and their gender identity and a true longing for having a different body. The desisters, however, indicated that their desire to have the body of the other sex, if present at all, or the desire to be the other sex, was more related to the opportunity to fulfill preferred gender role than a true aversion against their bodies per se. End quote. This is what allowed gender clinics to sort out which children would and would not benefit from further support, including medical intervention in the form of puberty blockers. That's why puberty blockers have a near 100% success rate, because they've gone through a clinical selection. So if we can tell the difference, why then have places such as the UK started to restrict access to gender-affirming care, including puberty blockers? Fascism. fascism is why. Though that is a topic for another video. So again, if you appreciate what I've done here and want to make sure you see part 2 of this response, the best way to do that is to subscribe and hit the bell icon. That said, what do you lot think? Why did Hossenfelder lie to her audience about the evidence in support of gender-affirming care? Why does Hossenfelder hide her references behind a paywall? And do you think that's appropriate considering how she's targeting a particularly marginalized demographic, stoking the flames of hatred towards them? Did I miss something you lot noticed? If so, be sure to leave a comment down below. And if you appreciate what we do here and want to help out, please consider becoming one of our wonderful patrons who make our work possible. On that note, we'd just like to thank the following people: Matthew Kovac, Gert Van Voors, Hannah Banghart, Marble Wings, Sosh Daniels, Flynn, and Higgins the Seagull. And for myself, Adita, and Levi, take care now.